Hello.
Yes, I'm here. Hi, Eilish.
Okay, so I'll introduce you if you want to start sharing your screen while I'm doing that, maybe. So first of all, thanks very much to everybody for coming. My name is Eilish Ryan. I'm a work representative with the Workers' Party, and we've been organising, I suppose, generally educational talks online since about April, just to give people a bit more of an introduction to some of the issues we work on and something to do in the evenings. Today we're delighted to be joined by Subin Dennis. Subin was introduced to us by our comrades in Kranti, which is an organisation of the Malayali community, particularly left Malayalis in Ireland, many of whom have come from Kerala to work here. And we asked them if they would know of somebody who could present on how Kerala has responded to the coronavirus. So many of you will probably have seen in the media that it has had a particularly successful response to the coronavirus, and perhaps not uncoincidentally has a very strong left and communist presence in its government. So Subin is an economist and a researcher with the Tricontinental Institute for Social Research. He's based, I think, in Delhi, if I'm correct, or the institute is based in Delhi anyway. I'll let you, Subin, introduce where he is himself. And so he's going to give us a bit of a background to left history in Kerala and also how it has responded to the coronavirus. So he'll be speaking for about 30 minutes or so, and then we'll have plenty of time for discussion and questions afterwards. Okay. So if anybody has any problems with technology during the meeting, there's a chat box. If you look in the bottom screen, there's a button for chat. You can just click that and then send a message either to the group or to myself, and I'll respond to you. And just to remind everybody to keep themselves on mute during the meeting. I think everybody's getting used to all this stuff at this stage. Okay, so I'll hand over to you, Subin.
Okay. Thank you, Comrade Eilish. Friends and comrades, let me first thank the Workers' Party of Ireland and, of course, Kranti for inviting me to this discussion. From here in India, I extend my greetings and salutes to all of you. Eilish was saying that our office is in Delhi, yes. I used to be based in Delhi, but for the past few months, I've been based in Thiruvananthapuram, which is the capital city of Kerala. That's where I am right now. I was supposed to go back last month, but then due to the lockdown and travel restrictions, I haven't been able to do so. Eilish has asked me to speak for about 30 minutes. So what I intend to do is to give a short introduction, then get to the part where I make a short presentation on the history of the left movement in Kerala. That's when I'll start sharing my screen. And after that, I must admit that it's a presentation that I have already used a few months back, but the points are all still relevant because it's about history after all. And once I'm done with that, I'll get back to the part where I'll talk about the measures that have been taken in Kerala with regard to handling of the COVID-19 pandemic crisis. The way the state of Kerala has tackled COVID-19, of course, has got a lot of attention and appreciation. Let me begin with a word of caution. Kerala has not won the battle against coronavirus, not yet. The Kerala government is also quite clear that there is no room for complacency. We still need to maintain at most vigilance. Even small mistakes can lead to a big surge in crisis, in the number of cases. Nevertheless, when we look at numbers, there is some evidence of relative success of a laudable handling of the crisis. When we look at figures, we have, as of today, we have 1,238 active cases and number of deaths. Okay, I've got the number of deaths wrong here. Okay, I'll come back to that later. But more than 210,000 people are under observation. Most of them are in their homes or government-run quarantine facilities. 1,844 people are under observation in hospitals. Now, what Kerala has been able to do in the past few months, those it didn't come out of thin air. It has come as a result of its own past actions. Now, for example, if we look at what is happening in the UK, Boris Johnson apparently said that there is something called society. Long back, Margaret Thatcher said that there is no such thing called society. And now Boris Johnson feels that, okay, there is something called society. But then all these, this late realization cannot undo what was done in the past. All the measures of fund cuts against that adversely affected the National Health Service and efforts at privatization, all of these that happened in the past few decades, those cannot be undone. And similarly, what Kerala has been able to do or is unable to do, all of that will be circumscribed, limited, or determined by what it has done in the past. Now, when we talk about that, that's where the role of the left comes into the picture. The left, that is the communist left, is leading the state government in Kerala. So now I'll get into a brief introduction of the left movement in Kerala, which is primarily the history of the communist left in Kerala. So let me try and share my screen here. Is that visible?
Yeah, that's perfect. Thanks, Subin.
Okay. Okay. All right. Yeah, this presentation starts with a map of map of India, and as you can see, it's the part that is shaded in red. That is Kerala. It's a small part of India, although the population is actually quite big when compared to most countries of the world. Yeah, this presentation originally had a comparison with New York, but if I can make a comparison with Ireland as well. The population of Kerala is 35 million, but I believe the population of Ireland, that is the entire island of Ireland, including the Republic of Ireland plus Northern Ireland, would be about 6.5 million. So that would be the population in terms of comparison. Kerala also has a very high population density, which is 860 people per square kilometers. Now, the left movement in Kerala grew in the 1930s and the 1940s through these three things. One is the social reform movements, which were primarily against caste oppression. The second, anti-feudal struggles of peasants and the trade union movement. And third, anti-imperialist struggle, which is basically the Indian independence movement against British colonial rule. Now, many of you might already be aware of what caste is. Without an explanation of what caste is, we cannot proceed when we talk about social reform movements and so on. So caste has been a central feature of traditional Indian society. It is rooted in both production conditions and the ideas of Hinduism. Now, in simple terms, society would be divided into numerous castes. People belonging to one caste are supposed to have one occupation. The son of a priest will become a priest. The son of a carpenter would become a carpenter, and so on. Now, caste Hindus are divided into 4 categories. At the top are Brahmins, the class of priests. Then comes the Kshatriyas, the warriors. Then the Vaishyas, who are the farmers and traders. Then Shudras, who are the workers. And then there are large numbers of others who are not even part of any of these categories. They are forced to do jobs that are considered the most polluting, such as, say, cleaning of toilets and so on. They are today known as Dalits. A large section of agricultural workers, for example, also would fall under this category. Now, social reform movements included movements against untouchability and unseeability. Many of you might be aware of the existence of this practice called untouchability. People who practice in traditional Indian society, people who belong to different castes were not supposed to touch each other. If they touch each other, they'll pollute, each other. Then they'll have to take a bath, or maybe do some rituals, or maybe isolate themselves for a week, and so on. So all kinds of things were there. All kinds of arcane rules were there. And there were, there was prescribed distances were there between people belonging to different castes. For example, people in Kerala, people belonging to the Kshatriya class, the warrior class group, and the priestly class, the Brahmins, they were supposed to maintain a distance of 12 feet among each other. Now, to the other extreme, the Brahmins, the topmost caste, and one of the lowest castes, Parayas, they were supposed to maintain a distance of 128 feet. Now, that would mean it is almost unseeable. So that's what is meant by unseeability. Brahmins are not supposed to see Parayas. Okay. Now, if they come in seeing distance, the Brahmins will get polluted. And of course, since Brahmins wield more power, if the lowest castes come in seeing distance, they might get beaten. That is, the lower castes people might be beaten, or even beaten to death. So they used to unleash violence on people who violated the norms of distance pollution. So there were the most crucial movements with regard to the social reform movements were directed against these practices in the first place. And secondly, there were movements of the for the oppressed castes' right to use public roads. Many of the lower caste groups were not allowed to enter public roads, temples, or other public spaces, use wells, or even enter the roads outside the temples. So there were many movements to win the rights of the oppressed castes to enter temples and use the roads. And then there were movements for women's rights. For example, the right of widows to be allowed to remarry. Or even in many cases, in many communities, women were not even allowed the freedom to go out of their homes with any sense of freedom. So there were movements for such rights as well. So the communist leaders, the communist activists, many of them were very active participants in these movements. Some of them were also prominent leaders of such movements in many communities. Then we had anti-feudal struggles. These were movements against oppression by landlords. These were primarily movements of the peasant class, the peasantry. These were against excessive levies charged by the landlords from their tenant farmers, and secondly, against evictions of tenant farmers by the landlords, and for land rights. First, for the rights of the tenant farmers to establish their tenancy rights, and then later to get those lands in their names as ownership rights. There were also struggles for the redistribution of land for the benefit of the landless workers. And then we also had the trade union movement, of course, which was crucial in the fight for democratic rights, for workers' rights, and against untouchability as well. And thirdly, we had the anti-imperialist struggle. Many of you would know that the fight against the British colonial rule in India was led by this organization called the Indian National Congress. It exists even today. It is a major political party in India. It had many streams within that, from the left to the right. It was an umbrella organization, especially during the freedom struggle. Even now, but especially during the freedom struggle. And within the left stream, the left wing within the Indian National Congress organized themselves into something called the Congress Socialist Party. Now, many communists started their public life, apart from being leaders of the social reform movement and so on, they were also prominently active in the freedom struggle. Many of them were part of the Indian National Congress. They were leaders of the Indian National Congress. Later, many of them became leaders of the Congress Socialist Party. And later on, many of them joined the Communist Party of India. In Kerala, for example, in 1939, the entire unit of the Congress Socialist Party in Kerala joined the Communist Party of India. Now, that is one of the major reasons why the communist movement in Kerala is so big. Its mass base is so big because of this legacy of the entire Congress Socialist Party, which enjoyed massive popularity at that time, having joined the Communist Party of India. Now, India won independence from British colonial rule in 1947. The state of Kerala was formed in 1956 by bringing together the regions that spoke the language Malayalam. One of the prominent leaders of the communist movement in India was EMS Namboodiripad. I'll show you a picture of him. We'll talk about him later. He even wrote a book called Kerala, the motherland of the Malayalis. Malayalis are basically speakers of the language Malayalam. And that was a crucial work on the national question in Kerala. Every Indian state has a legislative assembly. This is just an introduction to how elections and so on take place in India. Every Indian state has a legislative assembly to which elections are held. The party or the coalition of parties which get a majority of seats in the assembly forms a state government with a council of ministers led by the chief minister. So Kerala also has a council of ministers and a chief minister. The first elections to the Kerala Legislative Assembly were held in 1957. The Communist Party of India won the elections and formed the government. And this was supposed to be only the second time in world history where a communist party came to power in a region or in a country through the ballot paper. The first was San Marino, which is a small country within the territory of Italy, as you all know. So this was EMS Namboodiripad taking oath as Kerala's chief minister. EMS Namboodiripad is the person without the cap in this picture. Now, the first communist ministry, it was a landmark event, of course, that the communists came to power in Kerala. This government set land reforms in motion, undertook reforms in education, expanded public healthcare, took initiatives to protect workers' rights, introduced fair price shops to supply rice and other essential commodities at affordable rates to the poor. And land reforms and education reforms enraged the ruling classes. The feudal conservative elements came together. These feudal conservative elements were led by the Catholic Church, for example. There were also caste and community reactionary caste organizations, and the ruling party of the time in Indian National Congress. So all of them came together in a notorious agitation, ironically called the Liberation Struggle. The communist-led state government in Kerala, as a result of all of these, was dismissed in 1959 by the Congress government at the center. There was also the involvement of the CIA. I thought some of you might be interested in this part of this presentation. So I have these quotes from the horse's mouth. That is, the CIA's role in Kerala first surfaced when Daniel Patrick Moynihan, who was ambassador to India from 1973 to 75, admitted this in his 1978 book, A Dangerous Place. We had twice, but only twice, interfered in Indian politics to the extent of providing money to a political party. Both times this was done in the face of a prospective communist victory in state elections, once in Kerala and once in West Bengal, where Calcutta is located. Both times the money was given to the Congress party, which had asked for it. Now, in an oral history interview he gave soon after Moynihan's book was published, Ellsworth Bunker, who was the US ambassador to India from 1957 to 1961, admitted his own involvement. And this interview also appeared in his biography, Ellsworth Bunker, Global Troubleshooter, Vietnam Hawk, by Howard B. Schaffer, which was published in 2003. Now, the Communist Party of India split in 1964. Let's not get into the details of how or why that happened. The party split into CPI and CPIM, and the CPIM is the Communist Party of India Marxist. And the Communist Party of India Marxist turned out to be the bigger party later on. An alliance led by the CPIM came to power again in Kerala in 1967. And let's dispense with what happened afterwards, but from 1982 onwards, two coalitions have been alternating in power in the state. One is the Left Democratic Front, the LDF, which is led by the CPIM, and it also includes other parties, including the CPI. Then there is the United Democratic Front, or UDF, which is led by the Congress. The LDF is in power now after winning the elections in 2016. What did the left in Kerala do? The first thing, of course, is land reforms. I had already mentioned that the struggle for land rights, the struggle against feudalism, feudal oppression, those were crucial in the growth of the communist movement in Kerala. When the communists came to power, in fact, in 1957, when the first communist ministry came to power, on the 6th day, it issued an ordinance banning eviction of tenants by their landlords. Subsequently, they passed a legislation. It was passed, but then it could not be really implemented because the government got dismissed. And then the Congress governments and so on, which came to power later, they significantly diluted the provisions in the land reforms legislation. Later on, it slowly started being implemented, especially after the second communist ministry came to power in 1967. They took some measures to reintroduce some of the measures that some of the provisions that had been diluted. Anyway, as a result of the land reforms, some 2.8 million tenant farmers got land. About 500,000 agricultural workers who were landless, they also got land. And this had a significant impact. It broke the back of feudal landlordism. It improved the bargaining power of both peasants and workers. So it had a signal impact on the entire society of Kerala. Second was, of course, public education, the result of which we'll come to some figures later. Kerala has India's highest literacy rates. Public healthcare, now, just as in the case of public education, Kerala's health indicators are the best in India. I'll show you some figures later. Democratic decentralization, which means that local self-government institutions, local bodies, they enjoy significant power and funds in Kerala, much more than, say, other states in India. And workers' rights. Kerala has India's strongest working class movement, especially led by the trade unions, of course. And the result of which is that Kerala has India's highest wage rates. Kerala also has India's strongest social security systems. Now, the result of all these things that the left did was that by the 1970s, in the academia, there started a discussion on something called the Kerala model. Now, what is the Kerala model? It basically said that it is not necessary for a country or region to wait till it becomes rich to bring about significant improvements in people's material conditions of living, distributed across the entire population, and that public action can be the driving force of such changes by forcing governments to adopt redistributive measures and other programs. Defined thus, it could be replicated elsewhere too. And in that sense, there is something called a Kerala model. Now, these are the figures that I was mentioning earlier. So, as you can see, India's literacy rate, according to the 2011 census, that was the last census which was held, was 74%. For Kerala, it is 94%. Life expectancy in Kerala is 75 years. India has 68 years. The infant mortality rate in India is 34 per 1,000 live births, and in Kerala it is 10. In fact, recently it came below 10. Wage rates. This is just an indicative. This is just an indicative figure because we don't have figures for all sectors of workers. This is just the daily wages in for male agricultural workers in 2016-17. India has 295 rupees per day, while that is the all India average, and in Kerala the average is 582 rupees per day. Now, as I was mentioning, this is EMS Nambudiri part. Since we are talking about, I'm trying to introduce you to the left movement in Kerala. But after all this talk, what is the point if nobody remembers any names? I'm not referring to the Malayalis who are attending this talk. All of them know the names, but perhaps others might find it useful. This is EMS Namboodiripad. He was the Chief Minister of Kerala twice, from 1957 to 59 and 1967 to 69. He was also the General Secretary of the CPIM from 1977 to 1992. Now he is a very significant figure in the history of the communist movement in India. He is a person known for his theoretical insights into a range of issues. He was, of course, an able administrator, agitator, orator, all of that. But his theoretical contributions are often considered among the most important, because to work in any society, you need to have an understanding of that society. And EMS's analysis of the situation in India, and especially Kerala, which was an agrarian society. So he had an astute analysis of the situation, the ground situation in Kerala. His analysis of landlordism, land relations, nationality formation, or the character of the Indian state and society, which actually influenced all of these influenced the position of the Communist Party itself, and the kind of demands that were put forward by the movements led by the Communist Party. Or his analysis or position regarding what can be done in a state government, because the Communist Party intends to capture state power at the central level. But then what happens if it gets state power? It gets elected to a state government. What does it do? What are the limitations? What are the possibilities? What are the limitations? And of course, India is a complex society with numerous castes and so on. How do you understand caste? What is the relationship between caste and class? So these are all things that EMS thought about deeply, studied deeply, and analyzed and clarified for the Indian left. This quote is from an editorial that Frontline, it is a prominent Indian magazine, wrote after the death of Comrade EMS. Of course, that's another picture. And this is a picture of a rally of the CPIM in Kannur, which is one of the strongholds of the CPIM in India. This is a Red Volunteer March. And this many of you might find interesting. These are just figures about the number of people who are associated with CPIM and major left mass and class organizations in Kerala. CPIM has 463,000 members in the state. The trade union, Center of Indian Trade Unions, has 1.8 million members. The Peasants Union has 4.9 million members. The Agriculture Workers Union has 2.3 million members. The Women's Front, the Democratic Women's Association, has 5 million members. The youth organization, Democratic Youth Federation of India, has 5.5 million members, and the Students Federation of India, of which I used to be a member earlier, has 1.3 million members. This is a picture of the current Chief Minister, Pinarayi Vijayan. That is Pinarayi Vijayan. This many of you might already know. This is KK Shailaja, the Health Minister. She has been hailed as the coronavirus slayer by many international media outlets. Well, those are the Twitter handles of the people. Basically, that's the end of my presentation on the left movement in India. In Kerala. I'm trying to end the sharing option. Okay.
That's
okay.
fine.
So that's one part of the presentation. So did I take long? I hope I still have the time for the rest of the presentation.
Yeah, no, it's absolutely fine. We only have one speaker, so feel free to continue for another 15 or 20 minutes. Yeah.
Okay. Yeah. I'll try to wind up within 15 minutes. Hopefully. Okay, so coming to the present. As I mentioned earlier, we could say that there is some success in relative terms when we talk about Kerala's handling of the coronavirus crisis. When I talk about what lies behind this, there are two types of measures that Kerala has taken. First, there are measures which are strictly related to COVID-19, and second, socio-economic measures that were taken to alleviate the difficulties that are caused due to restrictions on economic activities. Now, let's begin with the measures taken to contain the virus outbreak itself. The scale of the coronavirus outbreak in China was becoming obvious by mid-January. Most world governments had not really woken up to the danger. But the first meeting on this issue in Kerala was convened by K.K. Shailaja, the health minister, on 18th January. And Wuhan in China had not gone into lockdown yet. On January 22nd, the Kerala Health Department sent an alert to all hospitals and district authorities about the need to prepare for a contagious virus. And China locked down Wuhan on the next day, on January 23rd. On January 24th, Kerala set up a control room at the state level. On the 28th, it had control rooms set up in all the districts. Isolation facilities were set up in all the districts. And then the first case of coronavirus in Kerala and in India was reported on January 30th. Two more soon tested positive. By 3rd February, more than 2,200 people who returned from coronavirus hit places were under quarantine. Now, the vigilance exercise by the state proved effective. All 3 patients fully recovered in a few days, and there was no case of secondary spread. The number of people under quarantine also came down. But late in February, a second wave started. So we could think of, when we talk about Kerala's experience with COVID-19, so far we have had 3 waves. The first wave concerns people who came from China. The second concerns people who came from the other countries like Italy and Europe and US and Persian Gulf and so on. And in the middle of this second wave, I'll talk about it in more detail. But in the middle of the second wave, we had a lockdown. Kerala had a lockdown and India also had a lockdown. As a result, we had travel restrictions started even earlier, but all international flights stopped. But from May 7th onwards, international flights started again. That is to bring people, that is Indians, Keralites and so on, who were stuck outside. Because a large number of Indians work in all parts of the world. And many of them want to come back. Many of their visas might have expired. Many of them lost their jobs due to the crisis. Some of them are pregnant women. Some of them are elderly. Some of them are children who were separated from their parents and so on. So there were large numbers of such people who had to come back, and even others who are perfectly healthy otherwise. They were scared for their life because in many of these countries, people were dying without getting adequate healthcare. So many of them wanted to come back, and from May 7th onwards, tens of thousands of such people started to come back, and then we had a third wave. But how did we handle the second wave? And how we are handling the second wave and third wave are not entirely that different. So when I talk about the second wave, things will be clear, I hope. So late in February, the influx of people from other virus hit regions in the world intensified. The total number of positive cases in the state rose to 27 as of 18th March. It was the second highest among Indian states after the Western Indian state of Maharashtra. These figures were the result of more widespread testing by Kerala. At that time, in the whole of India, about 11,500 people had been tested. Out of those, Kerala accounted for 2,550. That meant that Kerala, which accounts for only 2.6% of India's population, accounted for 22% of the number of tests conducted in the country for COVID-19. Now, throughout this period, Kerala kept screening passengers who came into the state, not just by air, but also by road at 24 border checkposts, and those who came by trains. Now, one particular success that Kerala had was with extensive contact tracing. whereby those who came into contact with people who are suspected to have the virus were identified and quarantined. Route maps were used for this purpose. These route maps contained the details of the places visited by infected persons, and these are circulated, and people who are present at those locations during the time when the infected persons visited those places are asked to contact the health department. The route maps are widely circulated through social media and through GeoK Direct. It's the mobile phone app of the government of Kerala. And the help of elected representatives of local self-government institutions and community health workers was also utilized for contact tracing. The formula was clear: trace, quarantine, test, isolate, treat. Identify the persons who came from abroad or other states, trace the people who came into contact with them, quarantine all of them. And those who come from abroad or from other states are placed under quarantine either at government-run quarantine centers or at home. Primary and secondary contacts with infected persons are under home quarantine. Health department officials visit or call regularly to check whether isolation protocols are being followed at home. Those who do not have enough facilities at home for effective quarantine, they are put up at quarantine centers run by the government. And all those who develop symptoms associated with COVID-19 are hospitalized. One, testing and treatment are free and available to everyone in the state. Now remember, unlike many countries of the world, including some of the richest countries in the world, in Kerala, if you have COVID-19, you are never at, you are in the hospital. Nobody with COVID-19 or COVID-19 symptoms will be at home. Everybody will be in a hospital. Now, meanwhile, the health minister held daily press conferences to tell people what is going on, what is being done, and what the people should do. At later stages, the chief minister himself started giving press conferences. Meanwhile, more test centers were set up. COVID care centers were opened in all districts. More staff was appointed, 276 new doctors, 321 junior health inspectors, all of them were newly appointed. And meanwhile, other diseases were not to be neglected. Cancer treatment facilities were made available in all districts, which was not the case earlier. With the demands for masks and sanitizers going up, instead of leaving the problem to the free play of the market, the government took steps to manufacture them. The public sector took the lead to produce more medicines, hand sanitizers, gloves. And there is something called Kudemba in Kerala. It is a massive government-backed collective of groups of women in the state. It has about 4.5 million women as members. Now, Kudemba started making masks. Mass organizations of youth and popular science activists, they also started making masks and hand sanitizers and so on. The government launched a campaign. It's called the Break the Chain campaign, to encourage people to adopt the necessary practices to prevent COVID-19 infection. Government employees organizations set up hand sanitizer kiosks in front of government offices. The left-wing youth organization that I mentioned earlier, Democratic Youth Federation of India, it set up hand washing facilities in 25,000 places across the state. Kudemba conducted awareness programs for its 4.5 million members through its 300,000 neighborhood groups. Preparedness, utmost vigilance, strict adherence to protocol, transparency, all of these were crucial in Kerala's battle against COVID-19. Now, late March was when the rest of India, particularly India's central government, which is led by the far-right Bharatiya Janata Party or BJP, they really woke up to the threat posed by the pandemic, late March, while Kerala started its preparations in late January. Meanwhile, Kerala moved to the next step of acting to alleviate economic hardship. On 19 March, the Kerala Chief Minister announced a relief package. It started announcing socio-economic measures even before. For example, food for the children who are in schools and so on. And now educational institutions were closed. So the youngest children, food for them were now being delivered home after the closure of educational institutions. Unlike the central government, which announced a lockdown suddenly without any preparation, the Kerala government gradually placed restrictions. And the relief package of 200 billion rupees was announced before the lockdown was announced, not after. That's what the Indian government did. Indian government announced a lockdown all of a sudden, creating panic across the country all of a sudden, and announced a relief package which was completely inadequate a few days later. Now, Kerala's package included advance payment of pensions, free food grains to everyone for a month, a health package of 5 billion rupees, relaxation in utility payments, and tax payment deadlines for some sectors were extended. And there were several other measures. A lockdown was announced on March 23rd and implemented from March 24th onwards. Now, the first priority was to ensure food to all. This is something that the Kerala Chief Minister said repeatedly. Nobody in Kerala should go hungry. Now, in Kerala, food grains were distributed for free to all families. Those who were under quarantine at home and who find it difficult to access food, they are also being provided food. Senior citizens staying alone, disabled people, those who cannot cook for themselves due to illness, and others who will find it difficult to access food, they all were located. Now, there were local committees, ward level committees of local self-government institutions. They are doing this work with the help of volunteers. They are ensuring that people who are in need will all receive food and medicine. Community kitchens were set up by these local bodies in collaboration with Kudemba, which I mentioned earlier, to cook food, and this food is being delivered to the homes of those in need. A large number of people who are volunteering in these community kitchens are members of trade unions, are members of unions of government employees, and most of them are members of left-wing trade union, left-wing unions of government employees. The government has distributed grocery kits which contain 17 essential items to all families for free. The government also took steps to ensure the harvest of paddy, rice basically, to ensure the harvest of paddy is done without interruption. Steps were also taken to ensure the procurement of rice and several other crops and vegetables. Now, these were very crucial steps to ensure food security, because Kerala is dependent, Kerala is not fully self-sufficient as far as its food requirements are concerned. A lot of its food grains and other food items come from other states. Now, if there is a disruption in the supply chain, and if it becomes difficult for Kerala to procure food items from other states, then things will become really difficult. So this was considered absolutely necessary to take steps to improve food production in Kerala. Meanwhile, there were also measures for the welfare of migrant workers. Kerala has a large number of migrant workers from other states because Kerala has India's highest wage rates. There are millions of workers from other states who stay in Kerala and work in Kerala. But then their living standards are not comparable to the rest of the population. The Kerala government, right at the outset, recognized that accommodation facilities for the migrant workers were often not adequate to ensure physical distancing. Here we mostly use the word physical distancing instead of social distancing. Our slogan is physical distancing with social unity. So that's why I use the word physical distancing. Now, since migrant workers mostly don't have enough facilities to ensure physical distancing, it was decided to set up camps for them and to arrange medical checkups. Food and other things like masks or soaps and hand sanitizer, all of these were also made available in these camps. As of April 20th, that's when the latest figures I have is from April 20th regarding the number of such camps. 19,000, nearly 20,000 camps had been opened for migrant workers in Kerala. And 353,000 workers were staying in the camps. This was the highest number of such camps in the country. Mind you, there are much bigger states in India like Uttar Pradesh or Bihar and so on. But none of them have anywhere close to this high a number of camps. And information in various languages like Hindi, Odia, Bengali, Assamese, Tamil were circulated among the migrant workers to create awareness among them. The Kerala government took steps to protect the most vulnerable sections. It took special care of the destitute, those who live in streets and sleep on shop verandas and so on. They have been put up in secure places, and food is being provided to them. They are being given free food grains, grocery kits, and medicines. These are being distributed to various care homes like old age homes, orphanages, and homes for the disabled. Now, workers, that is government employees, have reached out to 37 lakh, that would be 370,000, 3.7 million. 3.7 million senior citizens, elderly, and inquired about their health status. And particular attention was paid to ensure the food and safety of people in tribal areas. Now, workers, as I mentioned earlier, Kerala has a very strong working class movement. And as a result, we have a very strong system of social security. This is implemented through a network of welfare fund boards. So there are a large number of welfare fund boards for workers in Kerala, workers belonging to various sectors. And all workers in the sectors with welfare fund boards are being provided financial aid through the boards. Workers who are not part of any welfare fund board are also being provided financial assistance. In short, public healthcare, public sector, local self-government institutions, cooperatives, collectives, and mass and class organizations of the people, all these have come together to make Kerala's robust response to COVID-19 possible. And there is a massive amount of voluntary work by government employees, as I mentioned earlier, union members, youth activists, student activists, and so on. And the Kerala government also set up a separate volunteer force, which has been crucial in the relief efforts. By June 9th, we had 326,000 youth registered as volunteers. These volunteers are working to identify those who need assistance, deliver food and essential items to people in need, provide emergency assistance at homes, help with the operation of call centers and control rooms, deliver materials to camps, communicate alerts, and help in hospitals. Now, the volunteers are deployed as necessary by the local bodies. So, to conclude, or to bring the various strands together, if you look at the approach that the Kerala government has taken, the efforts of the Left Democratic Front government are rooted in a comprehensive approach to ensure the welfare of all citizens. This is an approach which recognizes the importance of the public health care system, as well as other social and economic determinants of health and well-being. It recognizes that hungry people cannot be healthy. Well-being will often be beyond the reach of the homeless. So the LDF government's policy measures amidst COVID-19 aim to address all these issues in order to provide relief to the people. The objective is to reach everybody in need until the last person. As of 9 June, 116,000 volunteers had been deployed only to identify those who need assistance so that nobody is missed out. Now, the strategy of the government has been to mobilize its entire state machinery, including local self-governments, public sector, and along with that, the collective energies of the state's powerful mass and class organizations, cooperatives, collectives, as well as the seal of the citizens of Kerala for voluntary action. A large section of volunteers are members of various trade unions, unions of government employees, and youth organizations and student organizations, all of those. This is a strategy of total mobilization, which integrates the work of the state machinery with the work of the general public, with those mobilized by mass and class organizations playing a key role. Now, what is it that made all these possible? We have already talked about the history of the left movement. And these are all the result of public action in the state of Kerala. Government action itself is a form of public action. Government action to advance people's welfare in Kerala has been the result of pressure from mass movements. These have really taken place over a long period of time, right from the time when the first communist ministry was elected in 1957. Now we have gone through that history once, so I don't want to repeat all of those. Democratic decentralization, I think, needs to be mentioned in particular, because it was something that the left has championed over a long period of time. The biggest effort in that direction was something called the People's Plan. It was a campaign, People's Plan campaign, which was initiated by the Left Democratic Front government, which was in power from 1996 to 2001. This is how the local self-governments were really strengthened with devolution of funds and powers. Kudemba, which I mentioned, the collective of 4.5 million women. These are basically collectives of women organized in self-help groups with government support. This is also something that the left initiated in 1998 and strengthened in its subsequent 10 years. Public health care. It received its biggest boost in the last 4 years. You might remember that the current Left Democratic Front government came to power in 2016. Ever since it came to power, it has set in motion some missions to give particular attention to certain areas. One of them is called the Ardram mission, which deals with the healthcare sector. As per with the Ardram mission, all primary health centers are being upgraded to family health centers. Now, primary health centers are the lowest unit; they form the lowest unit in the healthcare system of Kerala. Not only Kerala, but India. There are family health centers, then there are community health centers, then there are taluk hospitals, district hospitals, medical colleges, and so on. Kerala is in particular known for the strength of its primary health centers. They were already strong, now they are being strengthened further. As a result of the Ardram mission, facilities in all government hospitals have improved greatly. Right now, if you look at all India rankings, the top 12 primary health centers in India are in Kerala. This is what has really enabled the healthcare system in Kerala to stand up to the challenge posed by COVID-19. In fact, while Kerala was strengthening its public healthcare system, the far-right government at the center was trying to privatize the healthcare system. In February this year, the central government proposed that the district hospitals in the Indian states should be privatized. And Kerala said, no, we are not going to do that. So to conclude, what Kerala has been able to achieve is a result of organized efforts by the people, especially the working people. It's a combination of state action and action by the general public, with those mobilized by mass and class organizations being playing the most central role. When the communists are in power, what you see as state action for the benefit of the people is also a result of the agenda set by the movement that is leading the government. I'll end with this, and thank you so much. There are
Brilliant.
questions.
That's great. Thanks very much, Subin. That was really, really interesting. I think particularly the point you made at the start, that now that we've all realized the damage neoliberalism has done, it's not possible to immediately change track is really important. I think, you know, there's like in Ireland, for example, one of the things is that's affecting us is that our class sizes are about 25% bigger than other European countries, and as a result, social distancing in the classroom, if schools do return, is an awful lot more difficult, and that's just not something that can be fixed overnight. So I think that's really important. So we have about 20 minutes for questions. So I suppose you can put up your hand by clicking more or clicking raise hand below the participant list if you wish to come in. Alternatively, you can put a question in the chat box. Alternatively, if there's complete silence, feel free to just jump in. So would anybody like to come in at this point?
Meanwhile, I would like to mention something that I missed earlier. The number of deaths in Kerala is 17, 17, due to COVID-19.
Fajis.
You can take it. Hi, can I ask you the question?
Yes,
First question?
yes.
Yeah. Hi, Subin. I'm a long time follower of yourself on Facebook. You know, what I was going to ask you is that there is. Any,
Child is the father of man.
apologies, there was a disruption. Sorry about it. There is a counter argument. People would say these landmarks achievements the left government, all the Kerala as a whole made, was not because of the left government efforts and interventions. They would say there was a Gulf boom which happened in the 70s. So that is the cause for all the achievements in the education sector and also in the health sector. Now, I have my answer as a layman who observe politics, but I will be very interested to hear from you, your view on this. Thank you.
Okay, thanks very much, Varjees. So we'll just take a few questions together if you want to make a note, maybe Subin. There's two questions there in the chat box also. Oshin is asking, could you compare the Kerala government response to that of the national government? I've heard how many migrant workers were sent home early on in the pandemic. And then secondly, I suppose similar enough, Rachel has asked, what is the political landscape like in the rest of India in terms of other communist or left-wing parties? So maybe if you want to give those three questions a go, and then if anybody else wants to come in, just raise your hand and I'll bring you in after that.
Sure. The first question regarding the argument that Kerala's achievements regarding human development, that is healthcare or education, are not due to the efforts of the left, but due to people basically going out of Kerala, especially to the countries of the Persian Gulf, sending back money, and then people buying those goods, that is education and healthcare, from the private sector. That's how Kerala improved its education levels or healthcare indicators. So that is one argument, not very seriously made by people in the academia, but often made in popular discourse. Although in general there is consensus that it is there is general consensus which gives the left the credit. Now, if you take the question seriously, the easiest answer will be that by the mid 70s, that is when the Gulf boom starts. That is when there was the oil shock, when the prices of petroleum went up, and which triggered the migration of large number of people from Kerala to the Persian Gulf region. And it was only from the 1980s onwards that the significant amounts of money started coming in. But by the mid 1970s itself, we already had studies which showed that Kerala had significantly improved its healthcare and educational outcomes. That's when people started talking about the Kerala model. So, Kerala's achievements happened much before the Gulf boom started. So it has nothing to do with, or little to do with the Gulf boom. And even the achievement of total literacy in the state was as a result of mass mobilization. It was the result of a mass campaign in the late 80s. That's how we achieved total literacy. We already, Kerala was already far ahead of other states with regard to literacy, but that last push to make it total literacy, it's not 100%, but near 90% at that point of time. That was made through a mass mobilization effort led by the government, of course. The second question, what is the political, could you compare the Kerala government's response to that of the national government? I've heard about how many migrant workers were sent home early on in the pandemic. Well, there are so many things that have happened. But if I can make just a few points, one is that when the central government led by BJP, with Narendra Modi as Prime Minister, when they announced the lockdown, there were no measures, there was no preparation, absolutely no preparation was made. Narendra Modi has this penchant for making dramatic announcements. So much so that when people hear that, okay, he's going to make an announcement at 8 o'clock at night, people panic. They don't know what is going to happen. So it's tragic. It sounds funny, but it's actually tragic because it affects the lives of more than 1 billion people. That's what happened this time as well. On March 24th, he announced that, okay, from midnight onwards, it's lockdown, which means that, millions and millions of workers won't have any job. In India, some 93% of workers are informal workers, which means that if they don't work for a day, they'll struggle. Now, when the government announced that, okay, from tomorrow onwards, lockdown, nothing is going to work. What are the people going to do? What are the workers going to do? So they panicked, and of course, since it's a lockdown from the next day onwards, people rush to all the stores and so on to stock up on things, whatever is possible. And meanwhile, many workers tried to flee, basically go back to their migrant workers, because there is a huge agrarian crisis in India, which has been going on for the last, say, 2.5 decades. And as a result of that, many millions of people from India's hinterlands, India's countryside, villages, they have migrated to the cities in search of work. And most of them are informal workers, casual workers. And they are all in trouble now. There are no jobs. Now when they heard of this announcement, all of a sudden, they tried to leave. Many of them tried to leave, especially those who, for example, if it's in Delhi, there are the neighboring states of Uttar Pradesh, and then Bihar lies a little towards the east. So workers from these states tried to, go, but then they found that they couldn't go. Borders were being closed, state borders were being closed. There were no transport facilities. Then, thousands of them started walking. Thousands of them started walking towards their homes. Many of them died on the way. I mean, it's tragic. And on the way, because they don't have food, they don't have water while they travel. And the Indian government has announced piecemeal measures, so-called relief package. And the money is nothing. I mean, India's states are strapped for cash, including Kerala. Kerala, it's not a rich, there are no rich states in India really. And with whatever limited amount of resources that states have, they are trying to do something. Kerala, for example, announced a package of 200 billion. What did the Indian government do? Indian government's relief package amounts to, say, 1.5% of the GDP or something like that. It's nothing when you compare it to the packages announced by governments across the world. 5%, 10%, 15% of the GDP. India, 1.5%. So India is a country where, as I said, 93% are in the informal sector. Hunger is rampant, malnutrition is rampant. Most people don't have access to proper healthcare or water or housing or sanitation. Okay. There are already starvation deaths occurring in Indian villages. Many of them are not being reported. People are not getting access to healthcare. People are being turned away from hospitals in many of the Indian states. So in some states, people who are diagnosed, tested positive for COVID-19, they are discharged after a few days, saying that, okay, now it's done. They are not tested again and tested negative, but the doctors feel, or the government feels that, okay, you have to, free up those beds. So instructions are passed that, okay, we have to, discharge as many patients as possible. So when they feel that okay, this patient is not critical, so that patient is discharged, and then after a few days that patient dies. And since that patient is not admitted in the hospital when he or she dies, that patient's number, I mean, that is not included in the number of COVID deaths. So it's like these are happening. It's a human tragedy of unbelievable proportions. We keep talking about that, take a long time. What is the political landscape like in the rest of India in terms of other communist or left-wing parties? Well, in India, the biggest communist party is the Communist Party of India, Marxist. The second is the Communist Party of India. Then, if you want a geographic breakup or something like that, apart from Kerala, there are some other Indian states where the left is strong. The state of West Bengal, the eastern Indian state of West Bengal, was a state in which the left was in power from 1977 to 2011 continuously. I mean, that government was also led by the CPI. It was a coalition government led by the CPI and included CPI and two other left parties called Revolutionary Socialist Party. These are much smaller parties, Revolutionary Socialist Party, RSP, and Forward Bloc. Then you have some other, there are some other states also. Tripura, which is a smaller state in northeast India. They also had Tripura also had a CPIM-led government, left-run government. Then in the other states, the strength of the left varies. There are pockets of Rajasthan where the CPIM is strong. There are small pockets of Maharashtra where the CPIM is strong. Small pockets of Himachal Pradesh where the CPIM has a strong presence. And in general, trade unions and the CPIM and the CPI are strong in the southern Indian state of Tamil Nadu. There is a significant presence of the left parties, both CPI and CPIM, in the Telugu-speaking South Indian states of Andhra Pradesh and Telangana. Trade unions are pretty strong in the southern Indian state of Karnataka, although the strength of the CPIM or CPI and so on are not very much. So it's a fragmented picture you have. Then there is one major Communist Party, which is outside the sphere of parliamentary politics. They don't contest parliament elections. It's called the CPI Maoist. It comes from a different tradition in the sense there was a split in the CPIM in 1967, and with a section believing that it's time for armed struggle. So they stopped contesting elections and so on. And that stream split into numerous other parties. And two of them merged in 2004 and became CPI Maoist. They have some presence in some central Indian states. Mostly they are in jungles, and they are in some zones that they call liberated zones outside the writ of the state. They control those zones. It's under their military control, and they are in a constant battle. That is physical battle, armed battle with the security forces, not the Indian army, but mostly the Indian police. If you ask me personally, it's a lost cause. It's pointless to fight the security forces and hope to win like that. And their influence is waning. Eilish, should I answer the rest of the questions?
Yeah, so what I might suggest, there's one more question there. Why do you think left communist parties don't have a stronghold in India as a whole? Where did we, I suppose, the Indian communist movement fail? I think we could certainly ask that question here as well. So if you want to ask that, and then what I might suggest is if anybody else has a question, can they either put up their hand or put it into the chat box, and we'll leave it at that once those have been answered then, because we're coming up to our time to finish. And I think it's 1 o'clock in Keralan now, is that right, Subin?
Yes, it's almost 1 o'clock.
So you probably need to get to bed at some stage, 1 o'clock in the morning. So if you want to go ahead and answer that, and anybody else who wants to come in, just let me know. Thanks.
Okay, so the, the sorry, the question is, why do you think left or communist parties don't have a strong hold in India as a whole? Where did we fail? What should be corrected? Sorry. Well, it's a big question. I wish I could, give a comprehensive answer or a perfect answer to this. But one major thing about India is that India is a caste-ridden society. I mean, the problem of caste is so deep that it is difficult for people to come together. Before we talk about socialism or communism and so on, there has to be a belief that people are equal. At least people should be equal. A nominal equality of people, that kind of a belief should be there. For example, if you look at the history of Europe, before the French Revolution, people believed that people are basically not equal. At birth, people are unequal. Some people, belong to the nobility. By birth, they are superior. Some people, or most people, are born into the peasant class or the serf class or whatever. They are by birth inferior. Now the French Revolution broke this. After the French Revolution, ideals of liberty, equality, and fraternity. So as a result, people have this notion that, okay, people are equal, although of course in practice, people are not equal. There are class inequalities and gender inequalities and so on. But still, at least in terms of notion, nobody will, not nobody, but most people will not try to argue in public that, okay, inherently some people are inferior, inherently some people are superior. That kind of argument will not be made. But caste is an institution which is prevalent in India, which says that people are not equal. And it still exists. This institution still exists. It's the worst kind of practices that I talked about earlier. So those may not exist, at least in Kerala. But elsewhere in the country, many such practices, different forms. In different forms, there are all kinds of practices which are casteist, or caste oppression, and so on. Those are still prevalent, which means that working class people, or peasants, they find it difficult to come together because they belong to different caste groups. And they are very easily mobilized by political parties and political organizations, which mobilize on the basis of these caste groups. And to overcome this problem, how it was overcome in Kerala, for example, was that we already had pre-existing social reform movements. Communist movement was preceded by social reform movements, and the communists themselves were part of the social reform movements. And when the social reform movements ran out of steam, the Communist Party itself led those social reform movements, and then they carried it forward. Now, such a thing can be done. It should be done elsewhere. Elsewhere in the country as well. It's not easy. It's very easy for me to sit here and preach, but it's a long and difficult task, and that is what we should be doing. We should be taking up all those issues. Of course, we should be mobilizing on class lines, all of that. And there are a number of organizational issues also which need to be sorted out. How to mobilize people in the age of social media, or fake news and WhatsApp messages and so on. So there are, of course, we need to innovate in terms of our mobilization strategies and so on. But well, these are some scattered thoughts I have. But the most important thing about India is that this notion of equality itself is missing in large parts of the parts of the country. There are some other states where some amount of social reform has taken place, or there is some space for more organizational activity. But it's a long road to take.
Thanks very much. Okay, so I see Shinit has her hand up. I don't know if there's anybody else. I don't think so. Oh, Kathy's come in with a question as well. Do you think the success of the response in COVID-19 in Kerala will help the communists to build even more support? Okay, so Shinit, I might bring you in there, and then Kathy's question is there for you as well, Subin. So if you just want to answer those two, and then we'll probably finish up after that. Shinit?
Hi, Subin. My name is Shinit. Actually, you have presented the things very, very well. It was much informative. I came from Kerala. All I have to ask is about the government of India. Now, more people are coming from abroad. About 2 lakhs people came to Kerala as part of Vande Bharat mission program. And the more people are on the way, So if the central government had already brought overseas Indian, the death toll in Kerala would have been less than 10. Would you agree that? The bad decision of the central government is affecting Kerala too in this pandemic situation. Would you agree that? That's the question.
Yes. No, I'm not really sure. Actually, I haven't thought about it that way. Especially when you give a specific number that, if people from abroad had been brought in earlier, the number of deaths would have been less than 10. I don't know. It's possible that the number of deaths would be lower. That is true. Less than 10, I don't know. But also, because there were travel restrictions, it gave the state some time to set up, facilities and so on. I'm not sure. I mean, it's not something that I have thought about that deeply. So I cannot give a, I'm not really sure. Not really. It is possible that the number of deaths of people who come from abroad, specifically that group, their deaths might have been lower. Yes. But overall, whether it would have affected our preparations adversely, not entirely sure, because these travel restrictions themselves were important. Actually, if you look at every or almost every country which has managed to keep the number of deaths at very low levels, they all had some travel restrictions. Although Venezuela actually sent flights abroad to Brazil and Colombia and so on to bring Venezuelan citizens from those countries back home. Although I'm not sure about the exact numbers. So it's something that needs to be thought about in the sense we need to make some calculations regarding how much resources we have, and then compare it with what would have been possible in that short span of time. So there are some countries which did such things, but most countries which actually had an effective response to COVID-19 shut their borders. And once you shut the borders and then stabilize things inside, then you can slowly open up the border and then bring more people in. I mean, it's tragic it's tragic that you have to think that way, because if there were production capabilities, if there were public healthcare systems everywhere in the world, you wouldn't need to do such things. And if all countries of the world had started preparations earlier. But this is something that needs to be thought about. I'm not entirely sure about what I said right now. I'll think about it and maybe get back to you, or maybe message Eilish or something if I have an answer later. To get to Kathy's question, do you think the success of the response of COVID-19 in Kerala will help the communists to build even more support? Well, that is something that we are all thinking about. But then the problem during the lockdown is that you cannot have large protest demonstrations and so on. You cannot have a rally of people. We do have some protests here and there, but with physical distancing norms maintained. So it's not easy to bring too many people into the demonstrations because you don't have transport facilities for such large numbers of people. So on the ground mobilization is difficult, but then there is some good image. There is some good word spreading about the communists. Of course, there are many of the national media outlets also have covered Kerala's response to COVID-19 well. Whether we can capitalize on it or not, to a large extent, depends on how we intend to do that. I mean, I have some ideas, but these are things to be discussed within appropriate organizations and so on.
Excellent display of decentralism.
Yeah, but today we had an excellent campaign. Today we had an excellent online campaign because in the northeastern Indian state of Assam, a few activists have been arrested and imprisoned under a draconian law. It's called the Unlawful Activities Prevention Act. It allows people to be imprisoned under flimsy charges and so on, and it gives the police too much power, basically. And these people, there was no proof that these people were guilty of anything. And one person, the so-called evidence that the central investigative, there's this investigative agency of the central government called the National Investigative Agency, NIA. So the only proof that they had was that in the communications of one of these people who are imprisoned, he has said Lal Salam and Comrade. Lal Salam means red salute. He has said red salute and comrade in some of his communications, so he is anti-national. It's ridiculous. So it became big news, and today we had a hashtag campaign on Twitter called Lal Salam Comrade. Hashtag Lal Salam Comrade, and it was trending at All India #1 for several hours today. Actually, from evening 4 o'clock till 1 or 2 hours ago, it was trending at #1. So there are things that we can do if we get our act together and use such methods to build ground support as well. It's not just online support, but also ground support. Our trade unions are doing excellent work. For example, in Delhi, the Center of Indian Trade Unions and DYFI is a very DYFI in Kerala, as I showed you, there are some 5.5 million members for the Democratic Youth Federation of India in Kerala. In Delhi, it's tiny, but with that limited strength, they have done excellent work to bring relief to migrant workers, because most migrant workers in Delhi have not received any government support in terms of food or medicine or whatever. And the Youth Front and the trade union, both of and especially the trade union, they have done excellent work in mobilizing funds from people across India and using those funds to buy food and distribute it among workers, and also get these workers to submit applications to the Delhi government for various benefits that they are supposed to get from the government, because many of these workers are illiterate. They cannot read or write. If at all they can read and write, they may not have smartphones, because many of these facilities, to access many of these benefits, you have to submit an application online, and these workers don't have access to internet. They don't have smartphones. They don't have laptops. Now our trade union is mobilized or making the effort to reach out to the workers, thousands and thousands of them, get them to submit application forms and so on. And now there are pockets of Delhi where there is some significant presence of our trade unions and our youth organizations. There are things that are being done on the ground. How to combine that with other possibilities? These are things that need to be taken more seriously. Yeah, these are the things that I can say without violating democratic centralism too much.
Good to hear, Subin. We always keep track of that. Okay, well, look, thanks a million. That was really, really informative and interesting. And I think we're all feeling a little bit jealous of the quality of services. So well done to the party and the organizations and activists who've maintained that over the year. And also, I just wanted to thank Kranti for helping us to organize the talk. And also in particular, I know loads of members of Kranti are working in hospitals at the moment and organising great solidarity activities at the same time. So we're looking forward to working with you again in person at some point in the future. And thanks to everybody for coming along. We have recorded the talk, so we'll put it up on YouTube tomorrow and you'll be able to share it with people. And just to let you know, this day week, next Wednesday, we have Ajamu Baraka, who is an anti-war activist in the United States. And he's going to be talking, he's involved in a number of Black rights working class organizations. And he'll be talking about the current situation in the US. And the following week, in a total change of direction, Fergus Whelan is going to be talking about a book he recently published about the United Irishmen, so the 18th century in Irish history. So if you want to check out the Workers' Party on Facebook, you can follow all of those events. And they're generally live streamed to Facebook as well if you can't make it onto Zoom. So Subin, thank you so much. Let us know if you're ever in Ireland, and we'd love to host you in person at some point. And best of luck with all the work you're doing at the moment.
Thank you so much. Thank you, Comrade Eilish, and thank you, Workers' Party and Kranti.
Great. Thank you very much. Good night, everybody.